Good afternoon. I'm joined today by the Government's Chief Scientific Advisor, Sir Patrick Vallance, and Dr. Yvonne Doyle, who is the Medical Director of Public Health England. Before I talk about some decisions taken today, and Sir Patrick provides an update on the latest data, I'd like to set out the steps we are taking to defeat coronavirus. Our step-by-step action plan is aiming to slow the spread of the virus so fewer people need hospital treatment at any one time, protecting the NHS ability to cope. At each point, we have been following scientific and medical advice, and we have been deliberate in our actions, taking the right steps at the right time. We are also taking unprecedented action to increase NHS capacity by dramatically expanding the number of beds, key staff, and life-saving equipment on the front line to give people the care they need when they need it most. This is why we are instructing people to stay at home so we can protect our NHS and save lives. I can report that through the government's ongoing monitoring and testing programme, as of today, a total of 438,991 people in the UK have now been tested for coronavirus. That includes 21,328 tests carried out yesterday. Of those, 108,692 people have tested positive. That is an increase of 5,599 cases since yesterday. 18,978 people are currently in hospital with coronavirus in the UK. And sadly, of those hospitalised with the virus, 14,576 have now died. That is an increase of 847 fatalities since yesterday. We must never forget that behind every statistic is a family member or a friend, and all our thoughts and prayers are with the families and loved ones of those who have lost their lives. These figures are a powerful reminder to us all of the importance of following the government's guidance. And as the Foreign Secretary outlined yesterday, the current social distancing measures will remain in place for at least the next 3 weeks. And there are 5 tests that must be satisfied before we will consider it safe to adjust any of the current measures. First, we must protect the NHS's ability to cope. We must be confident that we are able to provide sufficient critical care and specialist treatment right across the UK. Second, we need to see a sustained and consistent fall in the daily death rate from coronavirus so we can be confident that we have moved beyond the peak. Third, we need to have reliable data from SAGE showing that the rate of infection is decreasing to manageable levels across the board. Fourth, we need to be confident that the range of operational challenges, including testing capacity and PPE, are in hand, with supply able to meet future demand. Fifth, and most importantly, we need to be confident that any adjustments to the current measures will not risk a second peak of infections that overwhelm the NHS. The worst thing we could do now is ease up too soon and allow a second peak of the virus to hit the NHS and hit the British people. So I want to thank each and every person across the UK who is following and supporting the government's advice to stay at home in order that we protect our NHS and ultimately save lives. I know we are asking you to make sacrifices, and it is challenging, but we need to keep going. Working together, we will defeat this invisible enemy. But now is not the time to let up. The risk still persists, not only for yourselves, but for the people around you. So we must stay vigilant. But of course, the point we hope to get to, one of the ways that we can defeat this virus, is to find a vaccine. Just as Edward Jenner developed the smallpox vaccine in the 18th century, we need to apply the best of British scientific endeavour to the search for the coronavirus vaccine. To that end, I can announce today that the government has set up a vaccines task force to coordinate the efforts of government, academia and industry towards a single goal: to accelerate the development of a coronavirus vaccine. This task force is up and running and aims to ensure that a vaccine is made available to the public as quickly as possible. The task force reporting to me and the Health Secretary is led by Sir Patrick and Professor Jonathan Van Tam. It comprises representatives from government, industry, academia and regulators. Members include Government Life Sciences champion Sir John Bell, as well as AstraZeneca and the Wellcome Trust. The task force will support progress across all stages of vaccine development and at pace. It will back Britain's most promising research, positioning the UK as a leader in clinical vaccine testing and manufacturing. The task force will coordinate with regulators to facilitate trials which are both rapid and well supervised. And it will work with industry in the UK and internationally, so we're in a position to manufacture vaccines at scale. This will build on the Prime Minister's announcement last month of a further £210 million for CEPI, the international fund to find a vaccine. I can confirm that the government has green-lighted a further 21 research projects to help fight coronavirus. In total, these projects will receive £14 million from the £25 million government research investment and include backing the development of a vaccine at Imperial College London. This follows support for 6 projects announced last month, including vaccine development led by Professor Sarah Gilbert at the University of Oxford Jenner Institute. This is already carrying out preclinical trials and, with government support, will shortly move to a clinical trial phase. And we're looking forward. So when we do make a breakthrough, we are ready to manufacture by the millions. One tool in this fight will be the UK's first Vaccines Manufacturing Innovation Centre based in Harwell, a project that will help build our capacity to develop and mass produce vaccines here in the UK. The government will be accelerating the building of this facility. The Bioindustry Association is also working closely with our task force and bringing together a whole range of businesses keen to use their expertise to mass produce vaccines as soon as one is ready. I want to pay heartfelt tribute to all the scientists and researchers working tirelessly on these projects. Yet even with all their efforts, we should be under no illusions. Producing a vaccine is a colossal undertaking, a complex process which will take many months. There are no guarantees, but the government is backing our scientists, betting big to maximize the chance of success. And I'm proud of how again and again Britain has stepped up and answered the call to action. An enormous challenge being tackled through a vast national effort, where problem solvers from science, business and government join forces to beat this invisible killer. We cannot put a date on when we will get a vaccine, but we live in a country with a rich history of pioneering science. And with the government backing our scientists, we have the best chance to do this as quickly as possible. Bond, could I ask you to look at... Yeah, indeed.
Can I have the first slide, please? So you've seen this before. This is the slide of transport use. You can see the dip in transport and using all vehicles over Easter that's come back. We remain very well placed in terms of the efforts that everyone has made to try and reduce their contacts. There is one point that I just want to make here, though, which is when we look right the way across the country, there is a little bit of unevenness, particularly in some areas where there haven't been many cases of the disease yet. And I would just urge everybody in every area to really apply the social distancing measures that are in place. And don't think just because you haven't seen it near where you are, it may not be there. It's very important we all do it. Next slide, please. This shows the cases, and as I've said repeatedly, this doesn't clearly show all the cases. It shows the cases that have been tested. The blue bars are the ones patients in hospital. You'd expect this to bump up and down a bit depending on the number of tests done. And you can see this has become flat over the last few days. And we would expect this to start decreasing in terms of total number of cases. The orange bars show the number of critical care workers that have been tested, and you'd expect as the number of tests go up that this orange bar will go up a little bit over time. The next slide, please, is the most important, that really shows what's happening in terms of the number of patients in hospital beds. And here you can see a gradual decrease in London, a flattening in most other areas, some decreases in some other areas as well. This is exactly what you'd expect from the social distancing measures that we've all taken, beginning to feed through into the number of patients in hospital and in turn the number of patients in intensive care units. It's here also that some of the work that's already underway, not in vaccines, but in treatments, is really beginning to take hold. I heard this afternoon that the studies that are underway in the UK have now enrolled over 5,500 people in clinical trials, trying to work out whether medicines that we've already got can work, have some effect in this disease, and we should start to get answers from these studies over the next weeks. So the numbers are not only at a plateau, but beginning to come down in some areas, and that will translate into fewer people in intensive care in due course, but do not expect this to be quick. This is not going to be a sudden drop. There will be a plateau. It will take a while for the numbers to come right down. And that's why it's important that we continue with the strong social distancing measures that we have in place and continue to do so for the next 3 weeks and need to do so right the way across the country. Last slide, please. Unfortunately, as the Secretary of State has said, deaths continue to occur from this disease, 847 in the last 24 hours. This is obviously a tragedy. I expect, unfortunately, this number to continue at a plateau for a little while and then to start come down slowly after that. So we are not through this yet. We're headed in the right direction. The measures that are being taken are making a difference, and you can begin to see it in the numbers, and we need to stay firm in terms of the actions we're taking. Thank you.
Great. Patrick, thank you very much for that. I think we'll move to the questions. The first question is from the BBC, Fergus Walsh. Fergus.
Thank you. 21,000 tests were carried out yesterday. How are you going to get to 100,000 tests by the end of the month with just 13 days to go?
Thank you very much for that, Fergus. So the capacity currently is 38,000 tests per day, and you will have seen further announcement from the Health Secretary in terms of testing for key workers as a result of the capacity that is in place. We are continuing to work to make sure that we get to that 100,000 tests a day by the end of the month. As you know, we've now got 26 testing centres in terms of drive-through testing centres, 2 of the 3 super labs that are then processing the swabs are up and running. The third one will be coming online shortly. And of course, GSK and AstraZeneca are also setting one up in Cambridge. So we are doing everything we can to make sure that we have the capacity available and making sure that we reach that target of 100,000 tests by the end of this month. I don't know whether, Yvonne, you wanted to add something on this.
Thank you, Secretary of State. So this has been very closely tracked, Fergus, too, and it is on track. We have more capacity than is being used. And I think the important thing here is that those now in social care and other key workers are enabled to use this capacity. We are confident that it is there for them. It's very important, particularly in social care, that they do accept the testing. And getting that organised and acceptable locally is the next key.
Great, thank you. Did you want to just come back, Fergus?
Question probably for Sir Patrick, which is when we do have a vaccine, how will you prioritise who gets it first?
Well, first of all, I think we've got to get a vaccine, and that isn't 2 days away, it's not 2 months away. Making a vaccine is a difficult, complicated process. It doesn't only have to work, it has to be safe, And of course, for a disease like this, it has to be very safe if you're going to use it right the way across the population. So there's a lot to do before we're in that position. And I think industry has stepped up and is looking at really big manufacturing capacity. I think it's going to be important that we vaccinate in the way that you normally do for these diseases, which is to make sure that the most vulnerable are protected and then to roll out to wider vaccination. But that's some way off.
Great. Fergus, thank you very much for that. I think the next question is from ITV Anglia, Emma Hutchinson. Emma.
Yes, thank you. First of all, to the Secretary of State, can I ask about the tourism industry? This morning, the Transport Secretary said he wouldn't be booking a summer holiday. In the east of England, the tourism industry is worth £7.5 billion. Can you offer any hope to that industry that there will be some kind of summer season this year? And then to Sir Patrick, the Norfolk and Norwich Hospital has opened a new surge capacity today, 170 extra beds. Are you still expecting a further surge of cases in the east of England?
Emma, thank you very much for that question. Look, the first thing I want to say is that I speak to businesses and business representative organisations every day, and I know how tough it is for a lot of businesses. That is why we have put in place the measures that we have in terms of supporting businesses, and particularly in terms of hospitality and leisure and retail. As you know, those businesses have a business rates holiday for a year. And in fact, for smaller businesses within those sectors, they're going to get a grant, and many of them have started to receive a grant of £25,000 as well. Additionally, you will have seen today that the Chancellor has extended the furlough scheme to the end of June, which will again help businesses. But I completely acknowledge that this is a very tough time for very many businesses. The key thing that we wanted to do throughout this whole process is to make sure we provide that support. So when we come out the other side, and we will come out the other side of this, those businesses are able to bounce back because the employees are still in place.
As I've said, I expect the numbers of cases in the community to be coming down. I think the R value is below 1 across the country. That takes a while to feed through. Most of the hospitals are beginning to show some plateau of the cases now, and you'd expect the same to go through into intensive care unit. I think the NHS has really worked very hard to make sure they've got the extra capacity, and we said at the beginning this is a mixture of how much demand there's going to be, which I think has now hopefully been damped down by the measures that are taken, and how much supply there is, and the NHS has been concentrating on building up that supply. So I think we are much more confident that the NHS is not going to have its capacity breached during this period, and that we are now looking at a time when we would expect to see a gradual decrease. It may occur at different times across the country. One final thing to say is, and I've said this before, as we get decrease in the community, it's also important to recognise that we have cases where the R may be above 1 in certain places like hospitals and care homes where there is still infection ongoing. Great.
Emma, did you want to come back on anything?
Follow up on when businesses might get back to normal. I know you've spoken about the vaccine today, or plans for a vaccine. Nadine Dorries said this week that the only way we can exit full lockdown is with a vaccine. Is that the case?
Well, what is certainly the case is that we are taking scientific advice from SAGE, and indeed it's very important that we have done that throughout this process. And as a result of that, you would have heard yesterday the Foreign Secretary saying that we're extending for at least 3 weeks the current measures. I think everyone watching this at home will understand why we're doing that. And I want to thank the British public, people across the UK who have responded at the last 3 weeks, and you've seen that in the stats that Sir Patrick has been showing us, is that they have taken the advice, they are staying at home, they understand that this is about protecting the NHS, and ultimately it is about saving their lives. We have put in place, as I said, a whole set of measures to support business, and we want to make sure that they are able to access that money. So in terms of the grants, we've made sure that £12.3 billion is now with local authorities. The latest stats, and I had a conversation with a whole range of local authorities yesterday, £3.7 billion has been paid out to small businesses, so almost 300,000 properties have benefited from that, but we need to make sure we accelerate that and continue to get that support to them. As I said, ultimately this is about making sure that we're saving lives, so we will always be led by the scientific advice. Thank you, Emma. Could I go to Sky and Thomas Moore? Thomas.
Thank you. Oxford scientists behind vaccine trials starting next week have said today that they are so confident that it will work that they will manufacture 1 million doses while those clinical trials are still underway. They hope those will be ready for September. So, Secretary of State, what is the government doing to secure that supply and then sign contracts to make sure that Britain is at the front of the queue for the supply of that vaccine or any other to protect the tens of millions of people in the UK? And can I also ask Sir Patrick, how do you balance the rapid development of a vaccine to save lives and exit the lockdown while at the same time making sure that it is safe?
So I think, Thomas, you're talking about the Jenner Institute, the work that's going on there. I have spoken in the last few days to the folks who are leading that work, and of course, as I said, we announced last month funding for that, and we are looking to see how we can continue to support vaccine development. And you're absolutely right. A key element of this is, of course, also manufacture. That is why we have announced bringing forward the development of the vaccine centre, but also working with the bio-industry as well. So if I can put it like this, is that we are supportive of the vaccines work that is going on at Oxford, at the Jenner Institute, but also Imperial, and ultimately we are stepping forward as required to support those efforts. But I completely get that this is not just about getting a vaccine, it's also making sure that we manufactured it in some scale.
So I think they've done a great job to get to where they are, and great kudos to the researchers involved at both Oxford and in the Imperial Group and others as well. There are something like over 100 vaccine projects across the world at the moment. At least 3 are in the clinic, we think. We know of 2 for certain. I think 3 are as well. Third is as well. We'll see more going into the clinic. Now, just to put some, again, realism on vaccine development, each single project does not have a high probability of success. So although everyone goes out with great enthusiasm and we hope they work, it's never the case that you know you've got a vaccine that's going to work. So that's the first thing that we need to be sure of. The second thing is then the safety. And it's incredibly important that these vaccines are tested properly. That's why it takes some time to get to the clinical trials and understand the potential unwanted effects of a vaccine. And then only when that has been done can this be used widely across the population. And so those are the stages we need to go through.
Great. Thomas, did you want to come back on anything?
If I may, yes. Britain is perceived to have been late on tests and late on ventilators. We can't surely afford to be late on vaccines as well. That would not be reassuring for the British population.
Well, just to focus on vaccines, I think that's been the point of setting up this task force, is so that there is full focus on vaccine development, but also in terms of therapeutic treatments as well. If you look at the 27 projects that we are backing, some are vaccines, some are therapeutic treatments. And what I would say to you is that as well as the work that we are doing in the UK and the projects we're supporting in the UK, we have also put £250 million into CEPI, which is the international body that is looking at this. And indeed, the CEO of CEPI sits on the task force as well, as a member of that. So this is a international global effort. And as Sir Patrick has said, there are over 100 of these projects that are online. And I hope that they will deliver success and that we will get a vaccine as soon as possible.
And I think we should just be clear, the vaccine could come from anywhere. Yeah. We've got a domestic vaccine in a discovery program in the UK, which is being supported and absolutely sent as fast as we can go. But the vaccine could come from anywhere. GSK and Sanofi have announced they're doing a vaccine together, which is fantastic news. Most of the big companies are doing vaccines. This is going to come from somewhere. We just need to back lots of horses at the moment and to make sure we're in a great position to access a vaccine when it occurs. And that's why organisations like CEPI are so important as well, to make sure that the world sees this as a way to get a vaccine. And we all need to be part of the same approach to trying to get as many vaccines as we can. And we may need more than one vaccine.
Great. Thank you very much for that, Thomas. Now going to Talk Radio, Charlotte Ivers. Charlotte.
Thank you, Secretary of State. Last week, Matt Hancock announced that there would be investigations into NHS workers who have sadly passed away from COVID-19. I'm aware that you won't be able to give me any details on individual cases, but could I ask if there have been any general findings from those investigations and whether any changes have been made in the workplace as a result?
Yeah. Well, can I just firstly pay tribute to all our NHS staff and those working in social care settings as well. And of course, every death is one too many. Investigations have started, are ongoing, and perhaps Yvonne, you might want to comment further on this.
Thank you, Secretary of State. So, as you say, sadly, we have a number of healthcare workers who have died during this epidemic. And the deaths, although the number is relatively small, each of those deaths is important to investigate correctly and fully. And that work is underway. There is also work underway, which you may be alluding to, around certain groups, perhaps both in patients and in the workforce, who may be more at risk, and particularly the signal that Black and ethnic minorities may carry a risk that is evident from these signals. And that work is also underway. So in both cases, it's very important in both that we actually come up with the right answers. There'll be a lot of speculation as to why people die and what may be the factors, but actually some of these factors are quite complex and they are being investigated correctly, and we're doing that.
Thank you. Charlotte, did you have a follow-up?
Yes, please. Could I ask if there's a sense of when these results and these preliminary findings might start to be coming back? I know if someone had died in my place of work, I'd be very, very anxious to hear as soon as possible.
Yes, Charlotte. So not all will be workplace deaths. That's the first thing. And then, importantly, to investigate what are the factors that led to death. So certainly, as soon as that is clear, that will be done. I think they'll be investigated and then communicated in the appropriate way at the right time. And I think it's much more important to get this right than to rush it. But it's seen as very important. Both these investigations are very important.
Great, thank you for that. Thank you, Charlotte. I think we turn to the Telegraph, Gordon Rayner. Gordon.
Thank you, Secretary of State. You told the CBI earlier today that businesses and employees would have to get used to a new normal and that things won't go back to the way they were even when the lockdown is lifted. Can you explain what you mean by new normal? And are you saying that some restrictions will have to stay in place until there's a vaccine, which, as Sir Patrick says, is a long way off?
Yeah, so well, let me talk a little bit about in terms of the workplace. We've been very clear that we are asking people to stay at home to protect the NHS and save lives, and very large numbers of our population are doing that. And we've also said in terms of work is that if you're able to work from home, you must absolutely do that, and employers are supporting people to do that, and I think that's very, very welcome. There are certain work settings, so you may be in the manufacturing sector or indeed the construction sector, where it is not possible to work from home and you have to go in. And what we have said is that in those circumstances, people can go into work. However, it's also incumbent on employers to make sure that they're following the Public Health England guidance in terms of working safely in the workplace. And certainly the conversations that I have had with employers, with employer organisations, I know that is what they're doing, they're adapting, and that's what I mean about the fact that where there is a work setting and people and those workplaces are open and people are going to work, we have to adapt the way that we are working, so we do that in a safe way and keeping employees safe. Do you have a follow-up, Gordon?
Well, I don't quite understand whether what you're saying is that you expect people to carry on working from home until there's a vaccine, or whether you're saying that you expect people to go back to work normally, but just to have social distancing.
No, well, let me clarify, and I apologise if I've not been clear on this. The measures that have been put in place were renewed yesterday, and we have made very clear that the message to the public is, for at least the next 3 weeks, follow the guidance that we put out, which is you must stay at home. It is about protecting the NHS, and ultimately it's about saving the lives of individuals as well. There are certain exceptions to the staying at home, and one of those is where people who are not able to work from home and are well and have to go into a work setting can go into work. But what has been very clear right from the start, and all the discussions I've had with individual sectors, with business representative organisations and individual businesses, is to emphasise that people must be following the Public Health England guidance in terms of safe working. And that is, I think, absolutely vital that happens. And I know from my conversations that actually employers are responding very well to that and working together to make sure they keep their employees safe. Thank you very much for that, Gordon. I think we now move to the Daily Mail and Dan Martin. Dan.
Thank you. The government has talked about easing the lockdown in some areas and strengthening it in others. Could you possibly give us more details about where the lockdown could be strengthened? Are we talking about different sectors or different demographic groups?
Again, I think it's very important at this point not to muddy the waters with talking about an end to the current measures. We are very, very clear, and the Foreign Secretary was very clear yesterday, that the current measures will continue for at least 3 weeks. We would require people to follow that, and at the end of that process, we will be guided by the scientific advice. But we've also set out very clearly, and I said that in my statement at the start, is that there are 5 tests that will have to be met before we can look at easing the current measures. And those 5 tests, again, are based on the advice that we're getting. But Sir Patrick, I don't know whether you wanted to comment on this point.
Well, I think you're absolutely right. The key thing we need to focus on now is maintaining these measures to drive this R and the numbers right down. That's what we must do. In terms of what happens after that, I think there are a number of options, and you can see what's happening in other countries as to how they're approaching this, as to how you might think about which measures to release first and how to do that across a range of possibilities. I think it's too early to be talking about that. I think we need to be concentrating on getting numbers down and making sure that the extraordinary efforts that have been made to get us to where we are today, which is now with an R, we think, below 1 in the community, continue to drive that down further and get these numbers down.
Dan, did you want to come back?
Well, can I just ask about face masks? Sadiq Khan was saying today that he'd like to see them compulsory on public transport. Is that something you're considering? And are you confident that there'll be enough masks if you decide to do that?
Well, I might ask Patrick to comment on that, but just to say is that the PHE guidance currently is that masks should be used in a NHS or social care setting. Clearly, there is a review that SAGE is carrying out, and of course, they will make recommendations and we will take those on. But Sir Patrick, do you want to comment on that?
We're looking at it now. I mean, the evidence is quite variable around masks. It's not easy to really get a firm position on some of it, and there aren't very good trials of masks. We're looking at the evidence now. We looked at it this week twice. We're going to look at it again on Tuesday and hope to be able to make some advice around whether any changes are needed or not. At the moment, we're entirely in line with the WHO recommendations. The difference between this disease and others is the pre-symptomatic and asymptomatic spread, which adds an added complexity to thinking about where masks may or may not fit into this. But one thing that's clear, and I think the Chief Medical Officer has been crystal clear about this, it's absolutely crucial that the masks are available in hospitals and in other settings which are a high risk of transmission, and that's where the evidence is very strong that they do work.
Great. Dan, thank you very much for that. The next question is from Left Foot Forward, Joshua Mortimer. Joshua.
Thanks, Josiah Mortimer, Left Foot Forward. Thank you, Secretary of State. As you know, care workers and NHS staff are putting their lives on the line each and every day to get us through this crisis. Was it a mistake for your government to brand those people as low-skilled labour? And to the medics, if I may, thousands of staff working in the NHS and the care sector only have access to the £96 a week statutory sick pay. Many of those workers can't afford to take time off when they have symptoms and feel pressurised to come into work. Do you recognise this as a threat to public health?
Joshua, thank you for that. Look, can I just say that I want to pay tribute, and I think you will find that absolutely everyone in government is absolutely united on this. We want to pay tribute to the selfless work that is going on across the NHS, across the social care sector, the way actually the whole country is coming together to deal with this particular issue. We need to make sure that we provide support to those who are supporting us, and that's why you've seen the work that has been going on in terms of testing, in terms of making sure that PPE gets to the front line, and we will continue to do that. I want to be very clear on this, is that the NHS workers are absolutely vital to us. We support them because they support us, and I'm very grateful for absolutely everything that they do. Yvonne, did you want to comment on this?
Thank you, Secretary of State. So, Josh, the frontline are the health heroes in this, and it's very important that our guidance has always been very clear on this. If you're not well, you shouldn't work. I understand what you're saying about people who feel they have to for various economic reasons, but it's really not in their interest. It may delay their recovery, and it may put those around them at risk as well. Therefore, it's very important also that they do get the equipment they need and that they accept testing, particularly if they're feeling unwell. There is now, as we've said, more capacity for testing than is being used, and the frontline are the priority for that. So that is what I would like to see, is that they accept that.
Josh, do you want to come back?
Yes, Secretary of State, if I may. I mean, you said that you value the work of NHS and care workers, but many care workers are on the minimum wage. I mean, would you commit today to ensuring that they do have full pay and full sick pay too?
Firstly, can I say just in terms of testing, so we've had 66,000 NHS staff and social care staff and their families who've been through the testing process. When it comes to making sure that support is provided, there's a whole range of support that we've provided to individuals and businesses, particularly in terms of the furlough schemes, in terms of grants. So we will continue to provide that support. And we've also said when it comes to statutory sick pay, of course, we will support smaller businesses as well for a 2-week period. So there is a lot that I think the government has done, but I want to be absolutely clear with you, Josh, is that we very much value the heroes that we have across our country within the NHS and, of course, in the social care sector as well, and we will continue to do that. Thank you very much for your question, Josh. Could I move to the Express and Star, Peter Madley? Peter?
Thank you, Secretary of State. Two questions for all of you. To start off with, parts of the West Midlands have a disproportionately high number of cases and deaths from COVID-19. Do you know why some areas of the country have been hit worse than others? And secondly, some hospitals in the West Midlands have said they're running critically low on PPE supplies. You've promised to boost supplies, but in a meeting this afternoon, West Midlands Mayor Andy Street said regarding deliveries that have taken place over the last week, what was promised was not delivered. Will our hospitals be better stocked after next week's deliveries?
Yeah, look, can I first say that I completely understand that people will be worried if there are shortages, and I'm aware of the supply issues that are being raised. There is, of course, a global supply issue. Everyone is trying to get access to PPE, and you'll have seen the Health Secretary announce some days ago a plan that we have in terms of more manufacturing in the UK, and I want to pay tribute to all of those businesses such as Burberry, and Ineos and Diageo and others who are stepping forward to help in that effort. But just in terms of the numbers, the local resilience forums have been getting supplies, and in the West Midlands, over 2 million items have been delivered by the LRFs in terms of PPE items. But you're absolutely right, we need to be on top of it. That is why we're working night and day in terms of making sure we procure more PPE, but then also expand the manufacture here in the UK itself.
Secretary of State, so I was going to answer your question about why certain populations, why certain places have more cases. I think this has changed over time. Initially, we saw cases coming from travel, and that has changed now to a very widespread distribution of this virus. So it has hit the cities. So we would have expected London to be early on in this, and indeed that's what happened. And then the Midlands as well, because of the concentration of populations. But there are other factors that may also drive this at this point, because as Sir Patrick has said, community transmission is now beginning to decrease. So we would now look to where care homes are, or indeed whether there is transmission within the healthcare system itself. And that's something that's being very closely watched every day as to where these hotspots, in a sense, are. I don't think we have yet seen the end of this particular phase, which is why it's so important that we continue with the advice on people taking this on social distancing, because I would expect to see this in other parts of the country as well. At the Midlands, we would have expected after London because of the population nature there and the density.
Great. Peter, did you want to come back?
Can I just ask you, Secretary of State, a different question? We've seen forecasts of the damage that coronavirus is going to do to the UK economy. Bearing in mind that the Treasury's coffers are being emptied out at the moment and will continue to be so for the foreseeable future, why are you proceeding with HS2, which is a conservative estimate it's going to cost more than £100 billion? Would it not be prudent to at least suspend work on the project while the country tries to get back on its feet?
Well, Peter, I think firstly, I want to pay tribute to the businesses that are working, that are carrying on, the people who are working from home, those who are going into work settings where they can't work from home. And I think it's really important we do everything we can to keep the economy going. But you're right, there is a major impact on our economy. There's a major impact globally as well as a result of this particular pandemic. And that is why we've put in place these unprecedented schemes. And you've heard, as I said, the Chancellor announced today extending the furlough scheme by another month. And the reason that we have done this is so that when we come out the other side, businesses are ready, the employees are in place, and they can absolutely bounce back, and that's vital. And you talk about the construction sector, the manufacturing sector. I think it's important that we support that and we continue where people are able to work safely to do so. As I said, for me, I think it's vital that we keep the economy going where we can. But again, this is not a trade-off. At the end of the day, people understand that the reason that we are asking them to follow the measures we have and the reason that we have extended these measures is about saving lives. And by protecting lives, we ultimately also protect businesses and jobs. Thank you very much for all the questions. May I just end by saying that I know it is very difficult for families, for individuals, and we are asking people to make sacrifices. But ultimately, this is about people's individual safety, and I want to thank everyone for what they're doing. So please continue to follow the very clear advice that the government has set out, which is stay at home, protect the NHS, because ultimately this is about saving your life and the life of someone you love. Thank you so much.